In case you don't know anything about our clinic or if you're still learning about us, we're a primary health care facility that does both dental and medical care. We have been around well, actually, before I mention that, Evelyn has our two locations listed here. So we have our West Clinic, which is our main location here in downtown Norcross. And then we have our East Clinic, which is located off of Jimmy Carter and Rockbridge. And right now, you see we have a little sign there that says temporarily dental services only. And that is going to change in March because we are going to be reopening our medical practice starting in March. And our reason for having that shut down for a little bit is due to some construction that we were seeing. So we're happy to kind of get services back going there, full speed on, modified a little bit for medical, but still being able to offer those services to everyone. And so we are also in the process of looking at a third location for Good Sam, where we hope to open up Access Academy, which is going to offer medical assistant training to those that are interested in wanting to go in the medical field. And as I mentioned, we've been around for about 20 years now. This is our 20-year anniversary. And so in addition to providing healthcare services, we do consider ourselves a training destination. So we do train master's level nurse practitioners and physician assistants, and they do their primary care rotation here. And we've got a lot of different partnerships with schools in the area. So this is part of what we consider to be community education, and we feel very strongly about letting our providers get in front of the community to tell a little bit firsthand about what they do on a day-to-day basis. And so today I'm pleased to welcome Cara. Cara is one of our nurse practitioners here at Good Sam. And I'm going to let Cara tell you about herself and her why, and give you a little bit of an overview of who she is and get into her presentation. As Evelyn mentioned, we do have time for Q&A at the end, but feel free to put questions in the chat as they come up. And if it's relevant with the topic that Cara is discussing, we may be able to get to them. Then if not, then we'll certainly make time at the end to answer any questions. So without further ado, I'm going to turn it over to Cara.
Thanks, Shameka. Hi, guys. Hope I don't talk too loud or softly. Um, yeah, my name's Cara Rushing. I am a nurse practitioner here, a family nurse practitioner here. I've been here, March will be 4 years, which is really kind of crazy. It feels like yesterday I was just starting. I was a student here for 6 to 8 months doing rotations here during COVID, which was a huge blessing. Good Sam allowed me to do a lot of rotations here and a lot of hours here. As other primary care practices were closing their doors to students, shutting down, Good Sam really was putting a lot of students first in those crazy first months of really trying to prioritize getting us through school, getting us through our program, getting us our clinical hours. And so that was my first impression of them, which is a great first impression. It was amazing to see how willing they were to not only take me as students, other nurse practitioners as well, other PA students as well. And yeah, then I came on full time with them after I graduated in March of 2021. I think that Shameka alluded to what's my why, and I think there's a number of different reasons. Number one, they were so kind and gracious to me during COVID. It was an incredible experience to get to be here for so many months. I was here like weekly for a couple of months in a row there. And I just really came to love the patient population. I feel like that's specifically kind of where my heart's been at for a lot of years. I've had interest in international medical missions. I've thought even about moving abroad to do medicine abroad. I've really just had a heart for international populations. And I feel like this clinic really blends those loves of me being able to be in America, which is where I'm from, where my family's from, but also care for international patients and practice kind of international medicine in America, which is a really incredible thing that we get to do and a very unique thing that we get to do. I also have fell in love with the fact that we're able to just be so open with our faith with our patients. I feel like that's a really unique place that we have here. I've been in the traditional healthcare system before, where kind of it was recommended to us that we would not share personal things or other things like that regarding our personal faith. And so the fact that that is encouraged here has really allowed me to connect with my patients, even though I can't speak the same language as many of them. I feel like our shared faith is something that really brings us together, and I really feel like has allowed for a really strong provider-patient relationship with a lot of my patients. Um, Anything else, Shameka, or should I just jump right in?
You can jump right in. Thank you, Cara.
Yeah, so today, in honor of February, which I think is Heart Health Month, Evelyn, correct me if I'm wrong, we are going to be talking about cardiovascular health, specifically cardiovascular wellness in the uninsured, as that's the patient population that we deal with on a day-to-day basis here at the clinic. Next, Evelyn. So, cardiac health. What is cardiac health? It is the health of the heart and the blood vessels, and it encompasses a number of different diseases. I listed a few here, but the list can even be more extensive than this. But the main things that we think of when we think of cardiovascular disease is heart disease, heart attack, stroke, heart failure, arrhythmias, and heart valve problems. So that's kind of all under the umbrella of the bigger cardiovascular disease title. Some statistics about cardiovascular disease and why it is important, and really important to talk about and educate, is because it is the leading cause of death for men, women, and people of most racial and ethnic groups, which that specifically applies to our patient population, as most of them are from minority racial and ethnic groups. One person dies every 33 seconds from cardiovascular disease. And in 2022, 880,000 people died from heart disease. So that's about 1 in every 5 deaths. This is in the United States, so this is not worldwide data. This is US data. But it's still quite staggering that that is as prevalent of a cause of death as it is. It also costs about $252.2 billion in the year 2019 to 2020. And it includes the cost of healthcare services, medications, and then lost productivity due to death. So specifically, I think that's referring to premature death. So like people who are dying at heart attacks at 40 or 50 are costing extra money because they're not dying when the normal life expectancy would be. All right, so when we talk about risks of cardiovascular disease, this is something I actually talk about with many of my patients because a lot of them come with some risks. And everybody has their own risks, and I kind of categorize it into two different categories. You first have your non-modifiable. So I explain to the patients, these are the things that you can't change. So that includes age, gender, race, and your family history, so your genetics. So if your father died from a heart attack at age 40 and your grandfather died from a heart attack at age 40, those are things that you can't change about your risk factors, but those are things that we need to consider when thinking about what your cardiovascular risk factors are. The other category of risk factors is those modifiable risk factors. So a lot of those are those lifestyle choices, which includes what your diet is, what that encompasses in your eating habits, what your exercise habits are, how much you are exercising, whether or not you smoke or you don't smoke, and then whether or not you have other chronic medical conditions such as high blood pressure, diabetes that could be modified or improved, and then what your weight is and how much stress you have going on in your life. All of those are to a certain extent modifiable. We have some ability to change what those are. And so that's kind of how we break up the risk factors into those two different categories. Okay, so what are some warning signs of cardiovascular disease? A lot of people know what a heart attack is or know what a stroke is. And the classic thing that we think of with those warning signs is chest pain or discomfort. So that's obviously a main warning sign for not only just a heart attack or stroke, it could also be even high blood pressure can sometimes present with some of these warning signs as well. Dizziness or fainting or almost fainting, which is syncope or called near syncope. Those are also some warning signs of underlying cardiovascular disease. Fluttering in the chest, I like to call it palpitations. Lightheadedness or a racing heartbeat. And then shortness of breath or a slow heartbeat are all indicative of potentially there might be some underlying heart issues or some cardiovascular issues that need further evaluation. Obviously, if you have any of these severe warning signs, go ahead and go to the next one, Evelyn. We always recommend if you're having severe chest pain, severe shortness of breath, or you're fainting, that we do recommend emergency help because ultimately waiting and getting at a doctor's appointment a couple months later, there could be some really critical time missed with treating those conditions that you may not even know you had. So if you have chest pain, shortness of breath, or fainting, that's definitely when we recommend going to the hospital and receiving emergency help. So, some treatment or, oops, sorry, ways to improve cardiac health. So, I talked about what are your risk factors and other things. So, a lot of these ways to improve are ways to change those modifiable risk factors. So, the first thing that most people don't think about, but is actually really helpful, is getting quality sleep. So, the recommendation is for 7 to 9 hours of sleep a night. We know that sleep is really important for resetting our body, letting our body rest, and is been proven to help with overall cardiac health. We recommend eating better, so improving your diet. We recommend the DASH diet, so that's low fat, low carbohydrates, avoiding red meats, eating lean meats, so like that's going to be chicken or fish, and then just increasing your whole fruits, raw vegetables. All of those are good recommendations for a heart healthy diet. We recommend maintaining a healthy weight because it's important for overall health and can help prevent and control many diseases and conditions that then lead to poor cardiac outcomes. We recommend activity, being more active. So the current recommendation is 150 minutes per week, doing some sort of moderate physical activity. And I'll touch on that later on in the presentation. But that's what we talk about with our patients. It doesn't necessarily need to be a 2-hour session once a week. You can break it up into whatever you need it to be, but the goal time all week should be around 150 minutes of moderate physical activity. Smoking cessation, so stopping smoking because any amount of smoking, even light or occasional smoking, damages your heart and your blood vessels and increases your risk of cardiovascular disease. So that's something we try to really press into our patients because a lot of people think, oh, well, if I just have a cigarette once a week, surely that's not affecting me at all. And research has proven that that does damage your blood vessels, does increase your risk of cardiovascular disease. And so we recommend all smoking cessation. Controlling cholesterol, unhealthy levels of cholesterol can increase the risk of developing heart disease. We go over a lot of how cholesterol contributes to plaque formation, which can increase your risk of heart attack and stroke. And so that's a common thing that we go over with our patients about monitoring their cholesterol levels, making sure those levels are within their goal range for them, depending on if they have any other chronic medical conditions. Managing blood sugar. So we want to maintain a stable blood sugar, and that's crucial for heart health because if you have diabetes or at risk for diabetes, that really increases your risk of those cardiovascular diseases. So that's definitely something that we monitor with our patients who are at risk. We want to make sure that we're managing their blood sugar appropriately, keeping it within that goal range that we're looking for. Blood pressure is the same. A lot of these is we just need to keep them in the healthy range. So blood pressure that is consistently higher than 130/80 can cause serious health problems, contribute to cardiac health issues, and is something that we closely monitor with every patient. When they come in, we make sure to look at their blood pressure, make sure that it's in the range that we're looking for. A lot of people don't realize that stress can actually really hurt your cardiac health. And so a way to improve that is to just manage your stress better, decrease stress in your life. So learning what healthy coping strategies are and ways to improve your emotional and physical health. Something that I review with my patients a lot is a lot of these ways to improve your health can actually go together. So a good way that I find to improve a lot of stress is if you increase exercise. So you're kind of killing two birds with one stone there. And I find that exercising gets you outside, gets you active, but it also can decrease stress. And all of those things are ways to improve our cardiac health. And then the last one is just practicing self-care and finding social support. So, studies have shown that a positive social support, close relationships, and feeling connected to others makes it easier to stick to these heart healthy habits that I'm mentioning now. Something that's really hard for people to do, especially our patients, if they're surrounded by poor diet habits or poor exercise habits, or a lot of friends who smoke together and stuff like that, is it's really hard to then stick with your own heart healthy habits. So surrounding yourself with people who would encourage you of those same good habits is something we highly recommend. You can go to the next one. Yep, thanks. So, treatment of cardiovascular disease. There is a wide variety of treatments, and I don't want to get specific because I'm not a cardiologist, I'm not a cardiac surgeon, I'm not going to know every specific things. But the general things that we think about when we are wanting to treat heart disease can include lifestyle changes. So, all those things I just mentioned with the ways to improve our cardiac health. So, diet, exercise, smoking cessation, everything like that. Medications. So that's something that we introduce with a lot of our patients here in our primary care clinic. Heart procedures and heart surgery is sometimes required if a patient is having severe enough symptoms or severe enough severity of disease. And so that's when we would refer out to our cardiac partners. Okay, so then next, Evelyn. So, what does Good Sam do to treat cardiovascular disease? Like I said, we are a primary care clinic. We are not a cardiac surgeon's office. We're not a cardiology office. And so, we want to make sure that we're doing everything we can to maximize our impact with our patients' cardiac health. So, we provide primary care management for them with a lot of medication refills or starting medications for problems that patients are having. We get lab results and monitor those, make sure that the blood sugar is remaining in the goal range that we're looking for, monitoring cholesterol levels, lots of different things like that that all affect our cardiac health. Lifestyle counseling. So, like I said earlier, we talk about what the modifiable risk factors are, ways to improve exercise and diet, other things like that. If needed, we always can refer out to cardiac specialists, and that's, I think, something that sometimes our patients don't realize the severity of their disease and they don't realize that they need to see these specialty partners. So that's something we can kind of walk through it with them, educate them on the need to, okay, well, you're kind of pushing the limit on what we can do here in primary care. And so we do have those cardiac specialists and cardiac surgeons and other things like that that we can refer to for procedures and other things like that. And then educational teaching and prevention counseling. So that's something that is a big part of what we do here of just educating patients on what is high blood pressure, what is diabetes, what can I do about it, what's the medication regimen, just a lot of educational teaching, especially from a lot of patients who sometimes come here with not understanding the U.S. healthcare system. Sometimes they don't understand the names of the medications. It's a really big point for us to make sure that we're educating them on these are the medicines that you need to take, and this is why you're taking it, and other things like that. So the next couple of slides, Evelyn, you can go to the next one, are just kind of examples of some different educational teaching things that we do with our patients. I find that visuals are really helpful, especially with the language barrier that a lot of us have with most of our patients being of Spanish speaking origin. So this is an example of like something we would give, like a diagram that we would give to our patients. It's the DASH diet for healthy blood pressure. I mentioned that earlier, how that's recommended not only for high blood pressure, but for diabetes and high cholesterol as well. So the recommendation is to get 6 to 8 servings of grains per day, 4 to 5 servings of fresh fruits and vegetables, and then lean proteins, so like excluding red meat, focusing more on the fish and chicken, and that's 6 or less servings per day. And then 4 to 5 servings per week of nuts, legumes, seeds. And then limiting those fats and sweets. So has the picture of the donut and the cake. Those are the foods that we want to limit and very much portion control. And then 2 to 3 servings per day of low fat dairy. So decreasing dairy or excuse me, fat in our diet, even in our dairy products. Okay, you can go to the next one. So then the other kind of aspect of those lifestyle changes is going to be the exercise recommendations. This is not specifically what we teach for our patients. This is just one doctor's recommendation, but it's a form of this is kind of what we recommend for our patients. So like doing something with your kids, going on a walk with your kids in the park, other things. Those are really good ways to become active, improve your blood pressure, improve your diabetes, other things like that. We recommend some high intensity workouts. So about 1 day a week is recommended to have high intensity, and then the other 2 to 3 days is be moderate intensity. So we recommend doing YouTube videos for Zumba or going to the YMCA for classes or riding an exercise bike. All of those would be considered moderate intensity workouts. And then some strength training as well. Some people go to the gym, lift weights, other things like that. All of those are good recommendations, and you can combine them together for a really good, what he says, exercise prescription for life. And then next one, Evelyn. This is a visual of blood pressure management and how to measure it appropriately at home. So that's something that, again, I was saying the educational piece is something that's really big. We always make sure that we're educating our patients on the proper way to not only take their medications, what times they need to do that, but also the proper ways to check their blood pressure, check their blood sugar, other things like that. So there's kind of like 3 or 4 tips that we recommend for our patients is we recommend that they are sitting. So we don't want them walking around checking their blood pressure or laying completely flat. We recommend that they sit upright in a chair. I normally say between 4 or 5 minutes in that chair before you check the blood pressure. You don't want to be running around your house, sitting down, checking your blood pressure. It's probably going to be a little bit high because you were just up and moving. So we recommend sitting for about 4 to 5 minutes upright in that chair. When you're sitting, you want your legs to be uncrossed and your feet to be flat on the floor. That does affect your blood pressure if your feet are crisscross applesauce and or if you're one leg over the other or whatnot. So we do recommend feet flat on the floor. And then we recommend that your arm is resting at heart level. You don't want your arm high in the sky, or you don't want it down by your feet or whatnot. We want it about resting at arm level. And then in this picture, you can see that the cuff is right above the elbow on the bare arm. So we don't recommend using wrist cuffs. Research has shown that they are not as accurate when checking blood pressure as a arm cuff. So we recommend using an arm cuff right above the elbow. And we recommend that you put it right on your bare arm. So sometimes that means having to take off your sweater or taking off your sweatshirt or something else like that, because that's the most accurate value. You're not going to have any clothes in between the blood pressure cuff and the arm. And then you recommend we check it on both arms. So you do it first on one side, sit for a couple minutes, and then do it on the other side. And then for our patients, at least, we recommend then writing it down. And that allows the patients and then the providers who are taking care of the patients to see those trends over time. Is it, why was it high this day? Did you forget to take your medication? Or why was it because this was a stressful week or something like that? And that allows us, just so the numbers are not in limbo, that you actually have them written down and we're able to kind of track what was going on with the blood pressure over time. Okay, last slide. So hold on, let me grab a sip of water. So I just added some success stories or kind of some real life examples of when in our clinic we've helped people with cardiovascular risk factors or helped people with cardiovascular disease, because there's a lot of that we do in our clinic. And I kind of just wanted to highlight a couple of general situations. Some of these are specifics, but could be examples of many patients that we have walk through our doors. So the first one is a middle-aged man comes in with kind of borderline high blood pressure, some mild prediabetes, and then his high cholesterol was just slightly elevated. But we start checking his blood pressure at home. We recommend increasing his exercise and improving his diet. And then his blood pressure and blood glucose return to normal. He doesn't have prediabetes anymore. His blood pressure is less than 120/80. And none of that was without medication intervention. It was just with some educational teaching and some monitoring with blood glucose and blood pressure at home. So that's something that we really try to implement implement for our patients is before we have to introduce any medication, let's try to do some lifestyle changes and see if we can improve your health that way. And many times it works that way, and that's really an incredible testament to the power of education, of health education. So the next patient would be someone who has really high blood pressure and a history of uncontrolled diabetes. So this is a patient that's going to need treatment medication, and potentially preventative medication for cholesterol, other chronic diseases like that. So, but by putting him on these medications, controlling these chronic diseases, hopefully we can avoid future cardiac events such as a heart attack, stroke, that's going to end up in the hospital, could lead to potential death, really severe disabilities, other things like that. So that's also another common patient situation that we see in our clinic here as well. And then the last one is a middle-aged woman just starts complaining of more frequent headaches. She didn't know that she had any chronic medical conditions, but she comes to our clinic, and through us checking her blood pressure over a few visits, her checking it at home, we diagnose her with hypertension. So we start her on a medication, we get her blood pressure under control, she starts checking it at home, doing all the lifestyle things that we talked about, and now her blood pressure is normal and her symptoms resolve. So that's also another situation where we newly diagnose patients with cardiovascular disease that they didn't even realize they had, but then hopefully we can prevent future life-threatening events from happening. I think that's it. Yeah. Are there?
Awesome.
Yeah.
So, Cara, thank you so much for going through those slides. And what I'd like to do, I don't think we have any questions in the chat yet, but what I'd like to do is really walk folks on the phone through what that new patient appointment would look like. So if somebody calls and says, either they know they have issues with heart pain or not
Yeah.
heart pain, but chest pain,
Yeah.
what does that first visit look like for those who are uninsured who come to our clinic?
Yeah. So like you said, it's honestly kind of 50-50 of both. Sometimes they know they have hypertension. Someone told them, a lot of times you hear, I was told years ago at a health fair that my blood pressure was high. So what we do is we bring them in, we get their vital signs. So that's looking at their blood pressure, their heart rate, their oxygen saturation, their temperature, their weight, looking at their body mass index, everything like that, kind of getting the full picture of what the patient is. And then we talk through, are they having any symptoms of what they're complaining of? So in a high blood pressure situation, you would start asking questions about, okay, headaches, chest pain, shortness of breath, anything like that. If any of those symptoms come back positive, we obviously further investigate that. And a lot of times, if they don't know they have high blood pressure and their blood pressure is elevated, sometimes they can be symptomatic as well. But I will say many patients are asymptomatic, and that's the other thing that I'm going to talk about is you don't want to say just because you feel fine that you don't have these chronic medical conditions, specifically hypertension or diabetes. But what we do is then we help them. So we kind of talk through the appointment with them, do a physical exam, and then in our educational teaching, depending on what the blood pressure is, sometimes we start medication at first appointment. Sometimes we wait for a later appointment to kind of monitor their blood pressure at home. But with any patient who has high blood pressure, we want them to be checking it at home. We know that white coat syndrome is a real thing. I see it every day with our patients. So what that means is when patients come to the clinic, their blood pressure is almost typically going to be higher than what it is on a regular basis at home because they come to the doctor's office, they're nervous. We have our white coats on, we look scary, so that's why it's called white coat syndrome. And so we really emphasize checking blood pressure at home on a consistent basis is the best and most accurate way to monitor progress with hypertension, diabetes, any of those kinds of different things. So we get them set up with where to purchase an arm cuff. We give them a blood pressure log. We have them pre-printed. So they write their date and they write their systolic value and their diastolic value. We explain that we want them to do it once or twice a day, depending on the situation. And then we emphasize we want you to bring that log back to the follow-up appointment. That way, us as providers at subsequent follow-up appointments can review that blood pressure log, make sure that okay, do we need to do an intervention at this appointment, or making sure our intervention was successful? Like I say, I tell patients, I don't want to give you medicine if the medication is not being effective. And so checking that blood pressure at home is one of the best ways to do that, specifically for high blood pressure. We check blood work on them. If they're new patients, we think that getting baseline liver kidney function, cholesterol levels, blood sugar levels, red blood cells, white blood cells, so like hemoglobin, other things like that is also really important too, to make sure that with our medication choices that we're not doing something that's going to be more harmful than helpful. Anything else? Or is that answering that question
Yeah,
appropriately?
no, it is because
Great.
I think, well, one of the things I want to kind of emphasize to, our listeners today is that, we do treat our patients and everyone who comes in here, is essentially given a plan of treatment to help them through this. So a large amount of chronic disease management that we handle. Um, and one of the good things about coming to Good Sam is that you are able to see the consistent provider. So Cara would know, your history as a new patient, kind of your journey in the process, and
Yeah.
hopefully see that improved. A second thing I want you to kind of touch on is for our, people listening, is our referral process. And you kind of alluded to it a little bit, but a lot of people think because they don't have insurance, that that's just it. You can't get any more help if you have to be seen by a specialist. So kind of walk us through what that process looks like for you guys as providers.
Yeah. Great question. We have, I would say as providers, we've kind of decided on some scope of practice limits that we have. And so if we feel like someone is above our scope of practice limits, if we feel like someone is too complicated for just plain primary care, then we would ask them to see one of our cardiology partners. And I do emphasize, I agree with you, Shameka. A lot of our patients are like, you guys are the only place that accepts patients without insurance. They'll turn me away at the door every time. And I think just again, going back to my presentation, talking about how education is just so important of teaching them not only about what they need to do during with their lifestyle changes, but also the education of what their resources available to them are, and explaining them that there are cash pay options at the places that we refer to. We do not refer anywhere that does not have a cash pay option, because that would not be accessible to our patients. So that's something that our care coordinator is making sure when we're setting up our partnerships with referrals is that there is the cash pay option. And most of the time, we know what that cash pay, like initial appointment, should hypothetically be. So we can hopefully give the patient an idea of what is going to be expected to be the cost of the appointment of the initial encounter. And then what we'll do is just we'll send a electronic referral. So what the provider does is a provider to provider electronic referral that we then fax to their office so they know this is the patient that we're referring over to them. This is the situation that's going on. And then we give the patient a physical referral form we write what the problem is as well. So when they're able to call the appointment, they know why they're scheduling the appointment with the referral as well. So hopefully closing the loop of communication with not only provider to provider, but also patient to provider and patient to specialist as well.
Yeah, and I know that's a big thing. We've got several partners in the city, in the county, around Gwinnett that we partner with that really do help us in this journey of taking care of our patients. And so we're very fortunate to have those connections to be able to kind of provide those resources. And then the last thing I want you to touch on before we wrap up is what do those follow-up visits look like and maybe frequency? I know it's going to vary, but like maybe kind of give us a little bit of an idea of how you guys do that.
Yeah. So the initial appointment is kind of where we do the full intake of the patient. So this is kind of getting the full patient history, the full medication history, really looking at the vitals, really looking at like symptoms and other things like that. So that way we can tailor our follow-up appointments to what is as appropriate for the patient. So sometimes that means patients with really high blood pressure sometimes come back within 72 hours. Sometimes patients with controlled blood pressure who need medication refills sometimes can come back in 3 to 6 months. So it really does depend on what the patient is, and that's why it's important to have a very thorough first initial evaluation to make sure that we're doing the most appropriate thing for follow-up. A general follow-up appointment, which is all of my patients this morning were chronic disease management follow-up appointments. So kind of what I did this morning with all of my patients is we go over their medication list. We make sure that they're taking the medications as prescribed, making sure there were not any miscommunications with the medications. Um, Something that like we frequently do is make sure the pharmacies print the labels on the bottles in English and Spanish for our Spanish speaking partners, just to make sure that the communication is appropriate and that we're not having issues with our patients not understanding what the bottle said and other things like that. So we'll go through the medication list. We'll go over what their logs are that they bring back. So if they have high blood pressure, we look at their blood pressure logs. If they need to be checking their blood sugar at home, we go over that log as well. We talk about what their diet and exercise has been at home, kind of are they making any lifestyle changes? We go over smoking, alcohol use, because all of those are important for risk of cardiovascular disease. And then we kind of make a plan based off of what's it been like in the interim since the previous appointment. We can go over some lab results. A lot of times we have our patients get lab results before they come to the follow-up appointment. So reviewing that before we make a plan also is helpful. That way we have all the information that we need, again, to make an appropriate plan and then an appropriate next follow-up appointment as well.
That's awesome. And I know it's a very involved and detailed process because so many of our patients are experiencing, chronic illness. I just want to kind of highlight that the providers here do a very good job of really kind of managing this. It's really a large number of patients that we see that are suffering from this illness and need a home-based primary medical care facility. So that's what we aim to do. So with that being said, does anyone have any questions? Or I want to make sure I don't see anything in the chat, but I want to make sure I allow time for questions before we wrap up. Thank you, Laura.
Thanks, Laura.
So with that being the case, I just want to kind of reiterate, as I mentioned before, the hours of operation for our clinic. So just want to highlight that we take anyone that is uninsured. So it does not matter. We don't have specific income requirements. We do collect income information because that is part of what we have to do for our for our HUD funding for this building, but we don't utilize that in making a decision for care. So we like to stress that anyone who is uninsured, who does not have a primary care provider or a dental provider, and we also don't have county restrictions, like line restrictions. So you do not have to be a resident of Gwinnett. You do not have to be a resident of the metro area. You can come from as near or far as you would like to be seen. So it really does offer access to everyone. And then you'll notice at our West Clinic, we have evening hours. So for those who work, if you need to come in after 5, we have staff available to help you. So we really appreciate you guys joining today. Again, this is going to be highlighted on our website as well as our YouTube page. And I'll let Evelyn kind of talk through those links on social media.
Yeah, thank you, Shameka, and thank you, Cara. Great information. So this is our social media. If you're not following us, please scan the QR code and follow us on whichever platform you find yourselves at the most, or if you're on all of them, that's great. We love it. We are constantly sharing information about how we care for our patients on these social media platforms, and also like today's Lunch and Learn will also be highlighted on these platforms. And so, yeah, it's just a great way to stay in touch with what Good Sam Gwinnett has going on with upcoming educational Lunch and Learns. We just have a lot of great things happening this year, different initiatives. So it's just a great way to stay in touch and continue to also just learn how we care for the uninsured in our community.
Awesome. That's very true. And also, I know we're going to kind of be putting this out there as a recording. So if anyone hears this during the recording, we do give tours of our facility. We do love to show the community what we do on a day-to-day basis. So you can definitely use one of those platforms to reach out to us or give us a call and let us know that you'd like to tour. Or you know someone who may need our services, but you kind of want to see and learn more about it. And certainly we operate on donations as well. So I would be remiss if I didn't put that out there. Most of our revenue comes from patient revenue, but we also accept donations. So if someone wants to help our mission, they can certainly do that also. So thank you guys so much for attending. Thank you, Cara. That was awesome.